Hey there, Rashid here, and welcome to the 6 hacks to acing your CPR test. You'll be glad to know that you will learn the exact same strategies and techniques that all our participants use to pass their CPR assessment every single time. There are 6 key areas to cover, so do tune in till the end, and I assure you it will be worth it. First, do allow me to quickly share a bit of background on this. In 2018, the CPR test criteria for laypersons in Singapore were revised to include a skill reporter assessment. But what is a skill reporter assessment? In a nutshell, a skill reporter is a special manikin that will record the duration of CPR performed, the quality of compressions and breaths, and the mistakes made during the course of the test. The skill reporter will keep track of how you perform CPR for a full 2 minutes. It will then report your performance along with an evaluation of your results. So you will instantly know whether you were successful or not. Now, hypothetically, if you have undergone sufficient CPR practice in class with an instructor, then you should be able to perform CPR well enough to fulfill the skill reporter passing criteria, right? However, it seems that this is usually not the case. Even with hours of practice, participants can still face challenges when it's time for the skill reporter test. Why? We are not absolutely sure, but it is highly likely due to factors such as lack of coaching or unaddressed mistakes during practice, fear, anxiety, and nervousness during the test, or pain, aches, and other barriers that prevent you from performing correctly. You are given 3 attempts. But the thing is, each attempt can be exhausting and might drain you out quickly, which is why it is important to strive to pass at your first attempt as much as possible. The 6 hacks introduced here aim to help you achieve this. So let's get to it. CPR hack number 1. Free your hands. One of the most common complaints when performing CPR is hand injury. The problem with injuring one or both of your hands is that you probably can't go on doing good compressions for the full duration. With an allowance of just 20% error, injuring your hands can almost surely seal your fate. So here are some ways to avoid hand injuries during CPR. Bare your hands and wrists. Remove everything you have on your hands or wrists before you start. This includes removing your watch, your bracelet, wristbands, or rings. Long sleeves can get in the way as well, so keep them rolled up. Hand position. Before you start, make sure you are familiar with where your hands should be placed. Place one hand on top of the other on the center of the chest. It doesn't matter which hand goes on top or underneath, as long as you feel comfortable. Some people like to place their dominant hand underneath the other. Again, this is entirely up to you. When placing one hand on top of the other, make sure the heel of the hand on top does not rest on the wrist. If it does, you can hurt your wrist or cause a skin injury. The heel of the hand underneath should be at the lower half of the breastbone. If it is sitting in the right position, you'll find that it feels right. Once you've got the right position, look at where your hands are and remember this position throughout performing CPR. Test your hand positioning first before you begin your CPR test. Put your hands in position, interlace both hands, and lift your fingers off the chest. Try a few compressions. If it feels normal and painless, you are set to go. If not, adjust your hands until it feels right. And then remember this position. If you do feel pain or discomfort over your hands or wrist, do this. Switch hands. If the right hand was underneath, switch with the left before continuing. If this doesn't help, place a thin cushion such as a folded handkerchief between both hands to protect the surface of the hand underneath. Loosen up your interlace grip and avoid pressing where it hurts. Lock your wrist in position so it doesn't move too much. Use a bandage or elastic wrist guard to provide support and cushion to your hands and wrists. CPR hack number 2. Body position. Did you know that by making some simple adjustments to your body position, you can significantly improve the quality and consistency of CPR? Here are some important tips to get into the most efficient position. CPR hack number 3. Compression techniques. You will need to perform a total of 150 compressions for CPR with breaths and a minimum of 180 compressions for hands-only CPR. Each compression is required to achieve a depth of 4 to 6 centimeters deep, and the chest must recoil back to the zero position after every compression. You must achieve 80% correct compressions to pass, so mastering compression techniques is critical. Let's get to it. Compression depth technique. To perform that many compressions correctly, you will need to use your full body weight to compress. First, do not bend your elbows. Make sure that you keep them locked throughout. Kneel at a comfortable distance away from the mannequin, such that when you get into the position for compressions, your shoulders will be directly above your hands. And if you are too far away, you may not be at the best angle. But once your shoulders are directly above your hands, you'll find it a lot easier to use your full body weight to compress downwards. Focus on compressing downwards. Use quick, sharp downwards motion when compressing to reach the desired depth. Then immediately release the force completely and allow the chest to naturally spring back up, back to the zero position. Note, do not move your hand or lift it off the chest when doing so. Always keep your hand in contact with the skin of the chest so that you maintain your position throughout the CPR cycle. If your position moves, you might put pressure on a rib or on the liver, and this can cause serious complications. Reminder, your focus should only be on delivering downwards pressure. Do not lean into the chest or hold down your compressions. Once you hit the right depth, always release the chest pressure completely. Allow the chest to fully recoil. Do note that each incomplete chest recoil is counted as a mistake, so you want to avoid that as much as you can. CPR hack number 4. Ventilation techniques. Each ventilation should deliver 400 to 600 milliliters of air over a 1 second duration. For CPR with breaths, you will be delivering 2 breaths after every 30 compressions. Head tilt chin lift. Before you can deliver good ventilations, you need to perform the head tilt chin lift technique correctly. The head tilt chin lift technique opens the airway, allowing each breath to enter and reach the lungs. Follow the steps in the next clip on forming the head tilt chin lift correctly. When performing the head tilt chin lift, avoid these common mistakes. Once you've performed a correct head tilt chin lift, you can now deliver breaths. Follow these steps. CPR hack number 5, the timing. You are required to complete your CPR cycles within a 2 minutes time frame. To be able to do so, follow these guidelines. Number 1, count out loud as you compress. This can help pace you throughout and complete all the compressions in time. You need to count at a rate of about 100 to 120 compressions per minute, something like this.
1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30.
Number 2, when performing CPR with breaths, do not make excessive movements when moving from compressions to giving breaths, and vice versa. This is unnecessary and can cause you several seconds of delay, which can eventually add up and cause you to miss the timing criteria. Instead, keep yourself firmly rooted in the position for compressions, only moving your body towards and away from the manikin's head whenever you need to give compressions. Number 3, do not waste time looking for the landmark each time after you deliver breaths. Use your visual senses instead to identify the position and log this in your mind. Each time you need to perform compressions, simply place your hand back in the same position. Number 4, do not spend too long to give breaths. You have between 6 to 10 seconds between compressions to give breaths. Quickly perform a head tilt chin lift and deliver the first breath. Do not wait for more than a second before delivering the second breath. Once both breaths are complete, immediately resume chest compressions. Saving 2 to 3 seconds each time you deliver breaths can save you up to 15 seconds on the overall timing, assisting you further to meet the timing criteria. CPR hack number 6, avoiding common mistakes. Hand positioning mistakes. Your hands must only be in contact with the lower half of the breastbone, in the center of the chest. If you compress too low, you may compress on the xiphoid process. This is a pointy, bony structure located directly above the liver, and compressing on it may cause it to puncture the liver, causing injury. Pressing too high would also be ineffective as the heart is located at the lower half of the chest. Always make sure you compress at the lower half at the center of the chest, not to the right or left where the ribs are, because doing so can cause ribs to fracture. Hand position mistakes are critical mistakes, which mean that you only need to commit them just once to fail your skill report. So pay close attention to where you place your hands. Ventilation mistakes. Ventilating too fast or too much can cause air to enter into the stomach, causing stomach distension. The skill reporter records this as a mistake, so you must avoid this. Deliver your breaths gently over 1 second until a chest rise is seen. Great! We have covered all 6 hacks in this video, and here they are again. CPR hack number 1, free your hands. CPR hack number 2, body position. CPR hack number 3, compression techniques. CPR hack number 4, ventilation techniques. CPR hack number 5, the timing. And CPR hack number 6, avoiding common mistakes. Follow these 6 simple hacks and you will find completing your CPR test so much easier. These hacks are a lifesaver not only in class, but more importantly, in a real-life situation where you really need your CPR skills to be at its best. I hope you've learned a lot from this presentation and it really helps you with your CPR test.